Hi, good day. I'm Yana Lumba, a first-year student from Capital State University, Dumarao Satellite Campus, currently taking up Bachelor of Science in Secondary Education, major in General Science. Due to this pandemic disease that have been spreading all around the world and that have caused fear to everyone, works, gatherings, and schools have all been cancelled for our safety. Our president have issued a community quarantine in Luzon and have placed the third of the Philippines on a sweeping lockdown. Due to this, the CHED, or the Commission on Higher Education, have thought of a way to still continue the classes through online class. Our teacher, Mrs. Arlene Laguda, have given us a chance to share our insights about this pandemic disease. So here I am creating this blog to pass on what knowledge I have about this pandemic disease that's spreading around the world and how to avoid it. What is coronavirus disease 2019? Coronavirus disease 2019 or COVID-19 is a respiratory illness that can spread from person to person. Coronavirus actually refers to a handful of diseases. The concept of coronavirus isn't new. The term refers to a group of viruses that are known to cause respiratory issues. So even though many are referring to the illness circling around right now as coronavirus, that is not actually the name of the disease. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China. Novel coronavirus is a new type of coronavirus that was not previously known or understood by health experts. The severity of coronaviruses can range from being mild, like the common cold, to more serious symptoms that can lead to a hospitalization, like lung problems. Some examples of previous coronaviruses include severe acute respiratory syndrome or SARS and Middle East respiratory syndrome or MERS. So to be precise, the virus is called novel coronavirus, and coronavirus refers to a handful of diseases. So now the disease is called COVID-19. COVID-19 can lead to major health problems like pneumonia and organ failure. And it can also cause issues like shortness of breath and fever. More on general symptom in a moment. People who are at the highest risk for severe complications from COVID-19 are those who are over 65, anyone who may be immunocompromised, and those with chronic medical conditions like heart disease, diabetes, and lung disease. How COVID-19 started and spread. Some coronavirus strains live in humans, and some live in animals. In the case of COVID-19, the virus was passed from an animal to a human. This is what the World Health Organization calls a spillover event. Every once in a while, one of these animal viruses gets rogue and jumps species from the animal species to the human, according to William Schaffner, a medical director of the National Foundation for Infectious Diseases and a professor in the Division of Infectious Diseases at Vanderbilt University Medical Center. COVID-19 is mainly spread person to person, likely through when someone coughs and sneezes. Transmission can happen when people are in close contact with one another, usually up to about 6 feet. COVID-19 can also live on surfaces up to a few days. So here are the symptoms of COVID-19 that we should know according to experts. They said that many COVID-19 cases will be mild. This means they'll feel similar to the cold or flu, which to be clear is still unpleasant, but means it's likely you'll have experienced something like that before. Some people may not have any symptoms at all but could still be infected. The main signs are a cough, a fever of 100.5 or higher, and a general malaise or uneasy feeling. Some may also experience nausea or diarrhea. A runny nose, sore throat, or upper respiratory symptoms with a fever less than 100 are more often seen in colds COVID-19. Patients with COVID-19 have had mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. Some people have no symptoms. Symptoms may appear to 2 to 14 days after exposure. That's why our government have made a 14-day mandatory quarantine for all the Filipino that came from abroad. What are severe complications from this virus? Some patients have pneumonia in both lungs, multi-organ failure, and in some cases, death. And what are the treatment for coronaviruses? There is currently no specific treatment for coronavirus. Antibiotics do not help as they do not work against viruses. Treatment aims to relieve the symptoms while your body fights the illness. You'll need to stay in isolation away from other people until you have recovered. What can we do to avoid becoming ill or having COVID-19? So, World Health Organization has these following precautions to avoid COVID-19. First, avoid large events and mass gatherings. Avoid close contact about 6 feet with anyone who is sick or has symptoms. Keep distance between yourself and others if COVID-19 is spreading in your community, especially if you have a higher risk of serious illness. Wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue properly. Avoid touching your eyes, nose, and mouth if your hands aren't clean. Clean and disinfect surfaces you often touch on a daily basis. World Health Organization also recommends these steps. Avoid eating raw or uncooked meat or animal organs. If you're visiting live markets in areas that have recently had new coronavirus cases, avoid contact with live animals and surfaces they may have touched. If you have a chronic medical condition and may have a higher risk of serious illness, check with your doctor about other ways to protect yourself. What can I do if I am or may be ill with COVID-19? First, follow the usual precautions to avoid respiratory illnesses and COVID-19, such as washing your hands often, covering your cough, cleaning commonly touched surfaces, and avoid sharing personal items with others. If you have symptoms or you've been exposed to the virus that causes COVID-19, contact your doctor right away if you have COVID-19 symptoms and you've been exposed to the virus. Tell your doctor if you recently traveled to or live in an area with ongoing community spread of COVID-19 as determined by CDC and WHO. Tell your doctor if you'd had close contact with anyone who has been diagnosed with COVID-19. Call your doctor or clinic before you go to your appointment so they can prepare and make sure others aren't infected or exposed. If you have symptoms, you've been exposed to the virus that caused COVID-19, or you've been diagnosed with COVID-19, first, you should stay home from work, school, and public areas if you're sick, unless you're going to get medicinal care. Avoid taking public transportation if you're sick. Stay isolated in a separate room from family and pets when possible. Wear a mask around other people if you're ill. Avoid sharing dishes, glasses, bedding, and other household items if you are sick. Use a separate bathroom from family if possible. Stay home for a period of time and follow your doctor's recommendations. You may need to be treated in a hospital if you're very ill. The disease is already here, so we can't necessarily prevent it, but the steps you take now can help minimize the spread of it. Be a good human, not only for yourself but for others. Thank you for listening, and may God bless us all. Thank you.